Today we'll be looking into psychotherapy. Now, see, psychotherapy, if you want to understand, even for the exam point of view, you need to know a bit of the basics. Those basics will be including, first of all, the definition of psychotherapy, because if you don't know the definition of psychotherapy, everything is zero. And to be specific, you need to know two definitions of psychotherapy, one by Woolberg and one by Holmes. Woolberg is the standard definition for psychotherapy. And after that, you need to know the definition that was given by Holmes. Followed by that, we need to know the schools of psychotherapy. If you don't know that, that is again a big problem because see, at times Viva, it is definitely been asked what are the various kind of school of psychotherapy, what is the definition of psychotherapy, then it will be difficult for you to answer. So without wasting any time, we should start with the very basics. That is why I have not prepared any notes. I will be writing again along with you so that you can get a wholesome idea regarding how to proceed with these topics in psychotherapy. First of all, if you look into the definition of psychotherapy, the word psyche, it means breath, spirit, and or soul. And therapia, it means cure. Know about this? Then let's look into the definition that was given by Woolberg. Also remember the year in which it was given, 1977. He mentioned that psychotherapy is a treatment by psychological means of problems of an emotional nature, of an emotional nature in which a trained person deliberately forms a relationship with the person with the objective of. What are those objectives? Let's look into that. With the objective of number one. Number one objective is removing, modifying. It is RMR. The mnemonic is RMR. Removing, modifying, or retarding existing problems. Number two, it is MB. That is mediating, mediating disturbed patterns of behavior. And lastly, the third part is PPP, triple P. Promoting positive Personality growth. This has been taken directly from the textbook of Woolberg. This is the complete definition of psychotherapy, that it is a treatment by psychological means of the problems which are of emotional nature by a trained personnel, not anyone XYZ. There are number of people in internet and social media giving therapy. Most of them are just fraud. They haven't done any kind of training. Even if the training certificate course doesn't count for training, deliberately forms a relationship with the objective of these things. Okay, this is the definition that you have to know by heart. You cannot say no to this. This is how Woolberg defined, and this is a standard go-to-go definition. The next one in this line is the definition by Holmes. Holmes has mentioned a relatively smaller definition. Psychotherapy is a form of treatment based on systematic use of relationship between therapist and patient as opposed to pharmacological or social methods to promote changes in cognition, emotion, rather he would use the word feelings and behavior. These are the three things. It's a very concise definition, but if you ask me, Woolberg is something that you cannot miss. Woolberg needs to be covered. For a final year resident, definitely it is required. If you're in first year, very good that you're starting early. You should be ahead of your seniors. If they haven't studied, you should take a lead. Fine. With this background, we are going to look into the schools of psychotherapy. Okay. Have you all done writing this? I can give 2 minutes if you want, but please write it down. I don't want this to mess up with the flow. Okay. If you are attending the session, attend it fully. Fine. If you're just if you're if you're done with the writing, then just let me know. Okay, done. Most of you are done. Fine. So the definition of psychotherapy is done. Let's start with the schools of psychotherapy. No, we won't be sharing these annotated notes, Adi. It's a request that please do write it down so that it is a good thing that you will be having the notes already prepared with you. Okay. There is no shortcut to active learning. That is what Psych Reads stands for. We do active learning. We need to have some kind of contribution coming from all the sides. If I am writing, you can also write. We all can write. Many of the people are writing. I can fairly understand that there is paucity of time, but I will definitely request everyone to please write. psychoanalysis, and psychodynamic psychotherapy. That is what was given by Freud. Number two, behaviorism. That is given by Skinner. Number three, existentialism. That is given by, remember three of the names: Viktor Frankl, Rolly, Rolome, and Anyalam. Then we have humanistic school, which is also called as integrative school. It was given by Carl Rogers. I'm not saying that these are the only people, but if you ask me, these are the names that you need to associate with these set of schools of psychotherapy. Okay, you need to know them. Then after that, we have cognitive school. Anyone could let me know who was the pioneer in this cognitive school? Very good. Aaron Beck. Aaron Beck. Correct, Prem. Correct, Bhavya. Okay, Aaron T. Beck. Cognitive school. That is Aaron T. Beck. Now, with this, these are the usual ways that we need, like we all study. Now, after this, there are some newer concepts also that we need to look. Can you name a few newer concepts? Anyone? Anyone? Two or three? Very, very common thing. Okay, I'll write it down. Newer concepts. Yeah, correct. Third wave psychotherapy. Shrishti will come to the waves of psychotherapy, don't worry. After this, the topic is waves of psychotherapy, and then we'll start with the classical or orthodox psychoanalysis. You have transactional analytical approach, correct, Ankita, ACT, all of those things will be there. We have Gestalt therapy approach. This is there. Yep, mindfulness. Next one is mindfulness. You can associate this with a number of things. That is why I've written only mindfulness. Then we have dialectic approach. Okay, who has given this this analytical approach? Anyone would like to name? It starts with E. The second name is B. Correct, correct, SK. All of you are correct. Ankita, all of you are correct. Very good. Now, Gestalt one, the Gestalt therapy approach was given by two names. I want two name. Come on, it starts with L. I'm writing the second name. This is Laura Pearls and Paul Goodman. Okay, then we have interpersonal approach. Fine. You have ACT, and the list goes on. Okay, but always remember these five schools. Next, we'll look into the modalities of psychotherapy and then waves of psychotherapy. In the modalities, five mode of psychotherapy you need to know. One is individual, one is group, couple. You can name any therapy based on the modality. Anyone would like to name the fourth one? Anyone would like to name the fourth one? What is that we are missing? We have individual. Correct, all of you. Correct, 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 correct. That is family. Family. I don't teach usually this fast. This just because it is a rapid revision. I'm compelled. I've been told by Dr. Prachi to teach not in the usual way. Take your time. Take your time. Write it down. Once you start using your hand, start using your pen and paper, your frontal cortex, your motor cortex, sensory cortex, all will be activated. You'll be able to register it fast. No matter if you read it from any PPT or from any of the notes, except if you read it from your textbook and underline it and write it down, all those things will not make that kind of impact. Are we done with this? Done, Bhavya? Very good. Okay. Nice that most of you are answering so nicely. Mentalization on ACTD, Ankita, very good. Okay, 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 Rishabh. Let's start with the waves of psychotherapy. Very common question which is being asked. You can get a short note also. You can be asked in your Viva also. What are the waves of psychotherapy? Now, first wave, let's start with the first wave. So, the first wave of behavioral therapies, let's start with this. Okay, we'll write important points, then we'll discuss. Fine. Included the method based on classical, based on classical and instrumental conditioning. Number two, method was helpful for people suffering from, what is the old name of PTSD? What is the old name of PTSD? Come on. Older name of PTSD. Think World War, bombs getting correct, correct, Sarthak. It's cell shock. Cell shock. Okay. Can you name a few who were important in this wave? Pavlov, Skinner. One more starting with W. Come on, anyone? WW. Bang on, Shrishti. Watson. All of their contributions, what we call it as learning theory, we learn to get out of the problems. Learning theory, whatever the first wave of psychotherapy gave, the achievements are still used by contemporary therapists. We also still use it. So if someone asks you first wave psychotherapy, whether the relevance is gone or not, no. Still it is being quite in use. We're using it in everyday basis. Next, since it is for an MD exam, that is why I'm restricting. Otherwise, we can have long discussion on this, but let's restrict ourselves. Second wave. Okay, second wave. Now, remember this was, just write it down here only, behavioral therapy, behavioral approach. Still, cognition was not taken into consideration. Behavioral therapy, or slash, write down the approach was quite behavioral. In the second wave, let's start with the second wave. Second wave, it is cognitive behavioral part. Now, cognitive behavioral part, what are the components? So here it includes, so there are cognitive models that are being developed, cognitive models being developed for mental disorder. These models, these models actually integrated beliefs, thoughts, belief plus thoughts, and these lead to the understanding of three things. What are those three things? World, changes in behavior, and lastly, it was emotional experience. Emotional experience. Okay, this is the time where Aaron Beck came into the picture. Anyone else would like to name another psychotherapist with the name A? Famous scientist is by that same name, the first name. Come on. Albert? Anyone? Albert? Not Bandura. Come on, come on. Think. It's not Bandura. Ellis. Correct. Haridas, correct. Albert Ellis. Are we done with this? The second wave? Take your time, write it down. I am happy if you're writing it down. You can take your time. I'm not in a hurry. By that, if you're writing, you can start with the third wave therapy. If you're done, just let me know. Good writing practice for exams, okay? Please zoom in. I'll zoom in. Zoom in or zoom out? What do you want? Shall I zoom in? Which part? I'm keeping it here for 15 seconds. Write it down. The last part of wave therapy was given by Karan Aujla, na? By the name. Third wave will come into third wave. There is a song by the name Wavy, isn't it? Let's start with the third wave. Let's start with the third wave. Fine. The third wave, very important. Now, see, it definitely evolved from the traditional approach. It evolved from the traditional approach, applied the cognitive part, to this there was add on elements. It was play. To this there was add on element like mindfulness, cognitive processing, therapeutic relationship. Then values started creeping in, and you can see there was a rise of religion based therapy which came with this. And to make it further ahead, spirituality also came. The rationale for adding such elements were that there is a need of more effective techniques to treat complex problem. Plus, need to develop one's personality. Okay, now let's start with what are the types of therapy which is included in third wave psychotherapy, the wave of therapy. Take your time, write it down. Waiting for 10-15 seconds. Done. Let's start. It includes dialectical behavior therapy, who gave this? Full name, please. Metacognitive therapy, acceptance and and commitment therapy, mindfulness. Okay, before that, let's write my favorite therapy, schema therapy, mindfulness based cognitive therapy. Yes, DBT. Marsha? Anyone has written the name? Marsha Linanen. Correct. Marsha. Who has given schema therapy? Come on, schema therapy, all of you. Full name, not only Young. Come on, come on. Jeffrey Young, very good. Okay. Who has given ACT? Come on, come on. Bang on. Stephen Hayes. This mindfulness one? Uh, three people. Okay, it was developed by. There are three key people. Others have contributed. Ankita, one of them, you're correct. John Teasdale. Let's write three of the names. Three of the names. What Shrishti you are telling, Zeen Kabat, you're not wrong. But let's come back. After writing these three, we'll write about Zeen Kabat also. John Teasdale, Mark Williams, and last we have Zindel Siegel. Zindel Siegel. All of these three were the pioneers. Now, John Kabat First of all, it's not John, it's Jon. It's not Zin, John Kabat. And Zin. They gave this mindfulness based stress reduction. That is called as MBSR. Okay. Is it clear? All of you, is it clear? Siegel, correct, 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 Purvasha, correct, Ankita. Now, one thing has been left, metacognitive therapy. Who has given this metacognitive therapy? Come on. No need to be sorry, Srishti. I know that you are correct. Just got confused at times. Why are you sorry? Come on. Metacognitive therapy. Who has given? Correct. Adrian Wells. So, see, all of you are contributing so much that everything is being covered in a way, in a go. Okay. So, kudos to all of you that you have been able to maintain your concentration for a period of 40 minutes and you have covered the basics of psychotherapy. We covered the definition, we covered the schools, we covered the waves, and we covered the modalities. Let's look for what is called as classical or orthodox psychoanalysis. Recording, yeah, this is a part of our Code Red series, and exclusive club member do get the recordings. If you get enrolled into the Code Red series, you will get the recordings. If you are a member of EC, you have all the benefits. Let's start with the classical or orthodox psychoanalysis. Okay, now one thing more. Who has given this? Who has given this classical or orthodox psychoanalysis? Come on. Who has given this psychoanalysis? Full name, please, Arthur. Come on. No, it's not Sigmund Freud. No, no, no. All of you are wrong. What's his full name? Sigmund Freud. What's his full name? Three words are there. What's the full name? Who is the founder of this? I need the full name. Sigismund. First word I am writing. Sigismund. What is the central name of Sigismund? Correct, Ankita. Shklomo. It's like calling Frederick as Freddy. Okay, that is what you have been calling him. Okay. May 6, 1856 in Freiburg. Now, let's start with there is a recent variation to this therapy. We don't do classical psychotherapy as of now. What are the recent, there is a variation of classical or orthodox psychoanalysis. It is known as Very commonly, you can hear in multiple CMEs that they are talking about this. It's called psychodynamic psychotherapy. Okay, let's start with the basics. The basics is, see, it's based on theory of sexual repression. Okay, and traces the unfulfilled infantile libidinal wishes in individuals' unconscious mind memories. So the key thing to note is the sexual repression, unfulfilled infantile libidinal wishes in unconscious memory. This is what is the basis. Now, in this all only, this is part one. Write down part two. Part two, method to discover the meaning and motivation of behavior, especially the unconscious element. That informs the thought and feelings. This is the method of doing so. This is why we are doing it. Okay. I hope you will not forget his name. Okay. Now, let's start with the overall process of analysis by Freud. These are referred as three things. What are those three important things? Let's look into this. One, two, three. It is recollection, it is repetition, and last it is working through. Remember, these are not the stages. These are not the stages. These are the steps in the process. Stages is totally different. Write it here, stages, and cut it. Please, please. These are not the stages. Let's see each one of them. Are you done writing with this? Okay. What about others? Okay, okay. People discuss a lot about Freud. The problem is they always fantasize him. Nobody discusses about what is actually the core things are. He used to smoke cigar, has a dog, whatnot. Let's start with recollection. Now, do you want to be covered in do you want this to be covered in depth, or shall we move recollection, repetition, working through? You'll read on your own, or shall we write it down? What does the house say? Shall we cover it? It will take around 15 minutes. Okay, let's start. Now, let's look into recollection. Recollection, it entails the extension of memory back to early childhood events. A time in distant past, where developed. What does that develop, up to which we have to go? Fill in the blank. So actually, if we are standing over here, Freud says we have to go back deep into your memory during that period of time where you might have been a kid or something, that something developed there. What was that that can develop over there that we are trying to look through? This starts with N. Come on, think N. Come on, come on. What are the two major divisions in psychiatry? One is psychosis, the other one is what is the other one? Neurosis. Great. So where neurosis developed, that is what you have to recollect. Don't just write. Focus also while writing. That you have to go back into the childhood where neurosis developed. So this is the time that where neurosis developed. So I have to go travel back. It's like time travel. Don't write this word time travel in your exam, or don't utter it. But just for the sake of understanding, it's like traveling back in time. Next, repetition. Repetition, emotional replay of formal interactions with significant individual in the patient's life. So you need to recreate. It's like playing the same situation. It's like rewinding the camera, looking back into it with the same situation, and all the interactions are the same. Remember, the word interaction is important here. You need to repeat those interactions which were going on when the neurosis was developing. Okay, now, so you have reached up to this place. You have recreated, you have seen the interaction. Now you have to walk through. Let's go for walk through or walking through. It's working through. Now, here you have to understand this. Okay. So in in Freud's original writing, after this, there is a resolution of neurosis. So that is what you have to look. So be attentive, please. Affective and cognitive interaction, which leads to integration of previously repressed memories that are brought into consciousness. Then, once you are bringing this into the consciousness, through this, patient is gradually set free. This leads to resolution of neurosis. Is it clear to you? Now we will see how the stages of psychotherapy will proceed. This is the three-step method that this is just the method that is being employed. Let's look into the stages. Okay, are we done with this? Okay, fine. Let's look into the stages of psychoanalysis. How many stages are there in psychoanalysis? Basically, remember like this: three, three, three in the process of analysis, three in the stages of analysis. Stage one, two, three. It's already 10. People are leaving because they have to get dinner. I think this is even tastier than your dinner. Definitely. Okay. Rishabh is finding it to be tasty. Nice. Stage one. Now, first of all, you need to familiarize with the method, routine, and requirement of the process. Surbi mentioned this word catharsis. We'll look into this. What is catharsis? Patient gains relief by catharsis and sense of security. This is that stage where your catharsis works. Okay. We'll look into the definition. Don't be in a hurry. We'll all cover everything. Now, the important thing is in this stage, you need one more thing. You need to develop one more thing, that is patient motivated by wish to get well. This does the magic over here. Okay. Are you able to understand this? It is very easy. Whatever we are reading as of now is easy. Okay. Now let's move ahead. Let's move ahead. Let's move into stage two. Stage two is transference neurosis. You need to have transference in this. Okay, please understand this, that you need to have transference for psychoanalysis. If that is gone, might not work. This transference neurosis is what substitutes actual neurosis of patient. Please don't get any bad idea regarding transference. Okay, there is, with this transference neurosis, there is a gradual resurfacing of unconscious conflicts. When it starts resurfacing, what you will do, you will repetition of, because now you have moved up to this stage, you have moved up to here, time travel has been done, now you need to repeat the thing. So you will repeat the childhood pattern. And recall of traumatic events. Okay, write it down, take a note of it. Once you are done, just let me know. Okay. Now, what is this? I'm just writing. Just please answer this. It's a one word answer that you need to know. Removal of symptoms. Please focus on whatever we are writing. Not a single line is unnecessary. Remover of symptom through verbalization of suppressed feelings with which symptoms are related. What is this called as? You're doing the same thing. You're talking to the patient. You are trying to bring the, um, uh, you know, resurfacing of the unconscious conflict. Come on. Is it catharsis? Srishti, is it abreaction? Now consider the scenario. Consider the scenario. Let's end it for once and all. Traumatic event, you are reliving it. Talk therapy, no, nothing like that. Not, it's a single word. Remember, Sathak, I have asked you a single word. Talk therapy is nothing. Traumatic event, relieving it, purging of emotional charge associated with it. I hope you are getting something. Once it is in the surface, expression occurs, and there is decrease of psychological burden. What is this? Recreation. Okay, what do you understand by catharsis? Just let me know. What do you understand by catharsis? Anyone would like to explain what do you mean by catharsis? Okay. See, when you look into the historical aspects, catharsis and abreaction, this just write this reference. The reference is a very keynote article that you have to read. Catharsis and abreaction in the history of psychological healing. If you have not read it, do read it. This is written by Jackson, PCNA, 1994. Here he has given a very clear-cut distinction that catharsis it means lively uh, remembering of traumatic experience in addition to emotional release. Ab reaction, on the other hand, means to emotional release. Now, here, if you're relieving it, leading to the purging of emotional charge with it, then expression occur to decrease the psychological event. Okay. If you are just verbalizing it through repressed feelings, and then you are not relieving the same thing, this is your ab reaction. Okay. I'll share this article with you if you have any doubt. Let's not keep anything hanging. Take a note of it as of now. The word catharsis has his roots from Plato and Aristotle, but as of now, in psychological basis, we need to know the meaning. Very famous article by Jackson. Some of the article will say ab reaction is a type of catharsis, but if you look into the roots, this is what you need to know. Okay. Now, let's look into one more thing that we are missing, stage two. There is an increased irrational attachment to analysts that develops. Let's move on to stage three. Are we done with this? Just let me know once. It's not boring at all. It is just that we are not well versed with the basics. Once the basics is clear, everything is a cakewalk. Then we'll look into transference, resistance, and repression. We'll look how what Freud meant by these three terms. Once you're done, just let me know so that I can proceed further. I'm seeing quite a lot of new faces this time. Done? Okay. Let's start with stage three. I hope all of you are enjoying. It's not getting boring. It's not just like a monotonous kind of thing that we are doing. All of you, are you enjoying the session? Okay, okay, it's fun. What about others? Only three or four people are replying. Now there is. Okay, dissolution of analytical bond. Psychiatry is fun. The problem is we need to read it in depth so that the understanding becomes easy and then we are able to apply. It's purely application based subject. Let's start with dissolution of analytical bond as the this is the hardest of the step because you need to dissolve whatever the bond has developed between you and the patient as the patient prepares to leave. And remember, patient may need additional assistance after the analysis is over. Okay, let's look into indications and contraindications first. Then we'll look into the patient prerequisite. All those patients on whom the method can be done. All psychoneurosis you can do. Contraindication also you should know because it's not possible for everyone to get under a psychoanalysis. The contraindication is this is as per CTP. Concrete thinking. Absence of psychological mindedness. Psychological mindedness. And close relation with analyst. It's a pure no. One more thing you can add, poor impulse control. Okay, these are the contraindications. Okay, okay, just to inform you that we are coming up with a theory revision course in which we'll cover paper 3 and 4 in detail. We have covered this topic. This topic will be all based upon your exams so that you can write your exam. The child psychiatry part will also be covered. Addiction, I'll be taking whole of the addiction, child, community, everything will be covered under this in 4 days. Okay. If you wish to, if you want to get it done in a matter of 4 days, you're welcome to join the session. Fine. Let's write down the patient prerequisite for psychoanalysis. Now, there are only four or five. First of all, there is high motivation. Next, there is ability to form relationship. Next, yes, I'll share the course details on the group. Timings also I'll be sharing. Ego strength. But remember that will be exam focus for the upcoming MD final year exam. We'll also take part two, paper two sessions on psychosis, mood disorder, OCD, suicide, everything. Paper one will be giving you a booklet which has been prepared by me and Dr. Prachi so that you can read it through. No charges for that. You're getting it for free, which is included in the course. Ego strength. First focus on this. I'll share the details later on. Psychological mindfulness and capacity for insight. Now see, ego strength is, what does it mean? It means that there is an integrative capacity to oscillate appropriately between two, I'm writing it over here, okay, antithetical types of ego functioning. Next, common question is goals of psychotherapy, this psychoanalytical psychotherapy. The first goal is gradual removal of amnesias rooted in early childhood, based on assumption, based on after this an interesting thing is coming, that is psychoanalytical setting. Okay, that is good. You need to look into that also. Okay. Assumption that filling the gaps in memory will lead to consolidation of, or rather consolidation, cessation, not consolidation, cessation of morbid condition. Why? Because the patient no longer requires it, because you have fulfilled the memory. Okay. And it gets fixed. Number two goal, n- write it down, take your time. I know many people are leaving because they're hungry, they need to eat food. We'll continue. Done with this? Shall we move ahead? Fine. The second one is the patient achieve a sense of okay. Let's start. Let's start. Self understanding. Okay. Let's look into some of the things that duration for which it should be done. Guess the duration. What should be the duration? Uh, Guess the frequency. Come on. All of you start guessing. Okay. So at one time, 58 people were there. Now 39 only. So 39 of you, please be attentive. What should be the duration of doing a psychoanalysis session? Think about it. Give a gross guess. All of you are correct. Very good. Jivitesh, Ankita, AB, it ranges from 50 minutes to an hour. What should be the what should be the frequency? Come on. What should be the frequency? How many times in a week? Uh, it is more. 2 to 3, it is 4 to 5 times a week. Okay, good attempt. And remember, how long does it it goes on? How long? People come to you saying that, oh, okay, sir, like for how long this tablet needs to be taken? How long will the session be required? So the answer is it goes on for years. Okay, it goes on for years. Many months are involved in understanding the patient. Many months are involved in understanding the conflict. Then how to form it, present it, then to resolve it. So it takes time. So Shrishti, you are also correct. Almost a year, it ranges to years. So Jivitesh, you are correct. It ranges to the years. Okay, let's look into the psychoanalytical setting, how the setting should be. So the space should be sensorily neutral, minimum external stimuli. Your favorite word, couch. Comfortable, relaxed, minimum influence of analyst. Also, observation of patient without interfering. That is why this is required. Next, it is also regarded as a tangen- tangentiality of Freud's legacy. Next, what is the fundamental rule? The fundamental rule is free association and relief of past events. Release of past events. Next, principle of evenly suspended attention. Okay, this is something that you need to know. It means the analyst requires to suspend judgment and to give impartial attention to every detail. That is why it is so, uh, you know, it is mentally exhausting. Next, in the same principle for the analyst as a mirror. Very important. Role of analyst. Okay, we are coming. We are coming. Indication and contraindication slide, sir. Okay. 1 minute, I'm just showing you. Where is it? Here it is. Simple. All psychoneurosis, and these are the six. Analyst as a mirror. So analyst as a mirror means, see, analyst should be a blank mirror and not bring personality into the treatment or any kind of judgment into the treatment. Okay. Let's look. Done. Done with the indication. Fine. Let's move ahead. Okay. So here we were. Analyst as a mirror means analyst is impenetrable to the patient and like a mirror reflects what the patient says. Don't mix and match your words. Also remember, analyst is a blank mirror and do not bring personality into treatment. No judgment, nothing. And last requirement is rule of abstinence. What does this mean? This means that the fundamental rule of abstinence, it refers to the frustration of emotional needs and wishes that the patient may have towards the analyst, or it can be a part of transference also. Done. Okay. It's almost 10:30. 1.5 hours gone. Okay. Let's sum up session with two more things. Could you show the setting? Obviously, I can show the setting. Here it is. Take a look. Okay, done. Can we extend the session to 20 minutes more? Or all you have to go and have your food? What do you want? Only four people want. What about the other? Okay. Because I want to, after this, I would like to go with the analysis of dreams. Okay. Analysis of dreams. And if 37 of you are here, I want 37 of you to attend this. Okay. So limitation of this whole method is all the points that are given in contraindication. And remember, it is time taking, and also money. These are the limitation. Usually, the uh, when we deal with this, this is the classical psychoanalysis. Okay, whatever we started was like the basis, the stages, the working principle. This is how classical psychoanalysis follows. Then we have steps, what we should be doing in analysis. I am cutting down short because after this we have three things. We have to look into psychoanalytical psychotherapy. Then we have to look into the brief psychodynamics psychotherapy. Then psychodynamic psychotherapy. Okay, brief focal psychotherapy. Okay, short-term dynamic psychotherapy. Multiple things will come. Rather than going into everything now, let's look into one of the core things of Freud, that was analysis of dreams, and then we'll sum up today's sessions. Okay, let's start with analysis of dreams. Short note, or even if you say that can be asked in your viva also, or mostly a note comes into this topic, on this topic, analysis of dreams by Freud. Now see, all of you know what is delusion work. Those who are attending psychopathology series, they must have known what is called as delusion work. Okay. Now see, delusion work is attaching meaning to the delusion, so that the delusion becomes more elaborate, which is called as systematized or organized delusion. Similar to delusion work, we have something which is called as dream work. Okay, so let's start with analysis. So Freud, why this dream came into his notice? So Freud realized that when his patient were talking during free association, most of the people would frequently report of their dreams. Along with associative material that stems out of it. So a dream is there, it starts being discussed, and later on, people derive multiple things out of it. And this was happening quite a lot. That is why Freud then started giving emphasis to the dream. And then you need to know two important things: manifest content. You need to know what is latent content. If you're hearing for the first time, congratulations. If you're not hearing, if you already know, then also congratulations. The motto gets fulfilled. You need to learn. Okay, so manifest content, it means it refers to what is recalled by the dreamer. Latent content, what does it mean? Latent content, it means unconscious thought and wishes that threaten to awaken the dreamer. Now, just listen to me for a minute. Pens down, please. If you go to your OPD, if you talk to any of your patient, be it in ward, be it in your clinics, OPD, ward setting, if you go for CL consultation, talk to them. If they are having neurosis, even if they are having psychosis, X, Y, Z, anything in ICD and DSM, if they are having, talk to them about their quality of dream, what they are dreaming about. Almost all patients will say that their dreams are bad when they are in active phase of illness. Their dreams are really bad. They'll say that either they're scary, threatening, it's like someone is going after their life, it's like someone is trying to kill them. Continue following up the patient, and when the patients gets starts to get better, now ask about the dream. There will be a drastic shift in that dreams are now good. I'm able to have pleasant dreams. So by this, he was not wrong in that. The only thing is, problem with Freud is the challenge. Once you challenge him, he goes away out of the room. Now, the manifest dream and latent content, all of you now know. Now, there is an unconscious. Please make a habit of asking dreams of your patient if you get time. And if you are good enough, write it down on the side of the OPD slip. So, the unconscious mental operations by which the latent dream content is transformed into this manifest dream content. This transformation is called as dream work. Is it clear to all of you? There are four things involved in this dream work. We'll just see. Is it clear to all of you? So, suppose if I am talking to you and I have been saying things. Ultimately, what happens? I start recalling about my dream, and you are able to get okay. Now he's telling about his dreams, what happened. Gradually, you called me the next day. Gradually, it is happening that whatever threatening is happening in my dreams, ultimately it starts cropping up in the manifest content. So he labeled that there are some unconscious mental operations which are going on that convert this to this. And to your surprise, if you study the biology of memory, which was given by Eric Kandel, he has given a firm neurological basis of this part. So nothing is wrong until and unless you get into the depth. Okay, people criticize a lot about everything. Before criticizing, at least read them, pay some respect. Now let's look into the steps in dream work. I hope this part is clear. Just let me know once. Okay. Now, fine, Rishabh, Akshay, Srishti. Okay, fine. Steps in dream work. The mnemonic is SIDS, CIDS. Number one, condensation. It means mechanism by which several unconscious wishes, impulses, or attitude can be combined into a single image. Into a single image in manifest dream. This is called as condensation. Several unconscious wishes, impulses, or attitude, you are mixing it up and combining it to form a single image, which is there in manifest dream. And now you are speaking it to the analyst. Second process is irradiation or diffusion. I'm writing it here only. It means a single, remember this, it is a single thing. There, multiple things were there. It was like this, it was like this, it was like this. And then you form a image, and then you have in manifest a dream. Here, a single latent wish, एक दबा हुआ wish that has not been resurfaced, or it has never come into the surface. Wish slash impulse that is distributed through multiple representations. In manifest dream content. So either there is condensation or there is diffusion. So suppose if you want to get rich or something like that, a dream, like a wish is there, you're not able to fulfill it, so it gets manifested in multiple ways. So you are seeing that a rival of yours is dying, you are getting alimony, you are getting money, you are able to get anything, and that will actually color the content, whatever. It can be anything. This is your diffusion. It manifests into multiple things. You are getting power of attorney, you are getting everything. Here it is, all of it is coming down into a single picture. Okay, now let's look into displacement. What is meant by displacement? Two things are gone. Third, displacement. Displacement is transfer of amount of energy. This is called as cathexis. From where you are transferring? From an original object to a substitute, because it is relatively neutral. So basically what is happening? Once you are doing the substitution, it is more acceptable. To a dream sensor, and can pass the border of repression easily. Last one is symbolic representation. In symbolic representation, what happens? An abstract concept or a complex set of feelings towards a person could be symbolized by a simple, concrete, or sensory image. Now, why Freud included the symbols? Freud realized that symbols have unconscious meanings. Okay, remember, symbols have unconscious meanings that can be discerned through patient's association with a symbol. So the mechanism of condensation, displacement, symbolic representation, okay, all of them, these are all part of your dream work, which he referred to as secondary process. So, sorry, not the secondary, primary process. Please pardon me. Because most of the times when we start discussing Freud, we usually end up discussing the topographical model of mind and nothing else. So we need to discuss more. Always we start discussing about the topographical model and that's the end. No, multiple things are there. One of them is analysis. Now, hypnosis to analysis, we'll do it next time where we'll look into what is transference, what is resistance, how to overcome resistance, the repression, concentration methods, what are free association. That is a hypnosis to analysis part that we'll do next time. But on this note, we are ending up today's session. I hope all of you liked it. I just want all of you, if you have understood the session or not, that is the main purpose. Okay, have you understood this? It was not about Freud, it was about a process that was given by Freud. Okay, now just one more minute. Keep the habit of writing, because in the exams you need to write it. Just one more minute, and if your exam going, three things that I want. Talk to your seniors, talk to your batchmates, arrange 5 to 6 years of question paper, make previous year question topics, revise them from an authentic book. Don't have FOMO because the content remains the same. You know FOMO, Rolo, and ultimately you know the meme. And always try to understand that content never changes. Only thing is race against time. If you have paucity in understanding or reading from an authentic book, you can definitely enroll into the Code Red series that we are organizing for all of you. It will have addiction part 1, it will have addiction part 2, it will have child whole, community whole, forensic whole, neuropsychiatry whole. On top of that, we'll have paper 2 psychosis, mood disorder, OCD, suicide, everything that comes in paper 2. Paper 1 we have covered, will provide you with the recording sessions, but we'll also give you a notebook that will have all the things covered with references, and charts, flow charts. Recording will be available to the people who are involved either in Code Red or in exclusive club. And if you want, you can get the definition Holmes. Holmes definition, Kirtana, here it is. I'm planning to organize another session on therapy where we'll cover the other segments of psychotherapy, the psychoanalytical part. Okay. And also we can plan to cover psychodrama, or maybe group psychotherapy is one of the topic that you need to know. Group psychotherapy comes as a question also. Psychodrama, group psychotherapy. Okay. And family therapy that was given by Minuchin. That is very important. Couple therapy, family therapy, group therapy. We'll be doing all of them. So Kirtana, are you done with Holmes? The definition? Thank you all for attending, and we'll inform Prem. Don't worry. We'll inform when the next session will be, and I am really happy that all of you were attentive. Started up with 59 people and ended up in 32 people. If you are this attentive, nobody can stop you from passing your exams. Keep it simple. Try to focus. If you have issue, you can join the Code Red. It's open to all. We're starting on all the topics will be covering in notes form, so that you can revise you can have you can revise it multiple times. You'll have the videos, you'll have the notes, you'll have the annotated notes, everything you will be having, all the topics. Also, we'll giving you an option so that if you want any topic to be covered in the session, we'll be covering that part also, so you don't need to worry. Okay, child psychiatry also, not only this, all topics that is added by the members will be taken into discussion. Addiction, I'll cover everything. For community also, we'll also taking all the topics that you want. Forensics, everything plus all the topics. Here are the details. I'll be sharing the details also. Okay, the timings all will be informed. Thank you. I'll inform the timings. Don't worry. Okay. Thank you all for attending the session, and all the best.